Hi, I'm Dr. Jake Kaufman, and today we're going to be talking about caffeine. We're going to talk about the supposed benefits of caffeine, the consequences of caffeine, and then most likely why you're here listening to this presentation is caffeine withdrawal headaches. And we're going to dive into that as well. I take care of a lot of individuals with headaches, with migraines, and oftentimes the individuality is missed in the care. Caffeine withdrawal headaches are another part of physiology where it's dependent on the individual and the factors involved in their life. But mainly, there's a genetic factor that predisposes us, to some of us, to get headaches when we stop having caffeine. Luckily, I am not one of those people that gets headaches. I can have 6 cups for 6 months and then stop cold turkey and not get a headache. I've done this before. However, my wife is not in that camp. She's one of those individuals that needs her coffee by 9 o'clock, or she's going to start getting a headache. And it has to do with the way that caffeine plays a role on the nervous system. So that's what we're going to be diving into today. So we're going to start with an overview. Caffeine in the U.S., how much caffeine we consume, what we know about caffeine, the positive versus the negative effects of caffeine, the nuance of caffeine, again, talking about the genetics factor and the other things that play a role in it, why we get caffeine withdrawal headaches, and if you get caffeine withdrawal headaches and you want to quit consuming caffeine, what you should do. So, caffeine consumption. In the U.S., we consume a lot of caffeine. We work a lot and we drink a lot of caffeine. In fact, up to 85% of adults consume caffeine daily. That's an average intake of 180 milligrams a day, equivalent to 2 to 3 cups of coffee or 4 sodas. If you got my coffee here, I'm in that 2 to 3 cups of coffee range. Like I mentioned before, I was at that 6 cup of coffee range. And then I was like, you know what, that's probably a little bit too much caffeine for myself, since that's about 360 milligrams of caffeine, almost half a gram. And that's what I try to stay under. So we consume a lot of caffeine, and we don't always have caffeine available to us, specifically when we're traveling in a different location, on a vacation. And for a lot of the patients that I take care of, that's when they start to get their headaches. Their headaches come back with a vengeance because they're off of their caffeine. They can't get the caffeine. So for a lot of individuals, there are multiple things that play a role in headaches. So when I look at a patient that has headaches, if we're working on the cervicogenic, so if their headache is coming from their neck, if their headache is coming from the vestibular system, if we're working on that to improve how those systems are working together and they're seeing a decrease in headaches, sometimes what will happen is they're going through care, they're doing really well, they haven't had a headache, they haven't had a migraine for a long period of time, and then they go on vacation, they don't get their caffeine, their migraine comes back, their headaches come back, and then they come back and they're like, hey, I had a big flare-up. What is going on? So that led me into really diving into the research of why we have caffeine headaches, and that's what I'm presenting to y'all today. So next up, what do we know about caffeine? Caffeine has a half-life of 5 to 6 hours. What that means is that if you have 50 milligrams of caffeine, and 6 hours, you're going to have 25 milligrams left in your body. And by 12 hours, you're going to have 0 milligrams of caffeine left in your body. Now, there is a lot of variation in that, as we see on this slide, and I'll talk about more about that. But that's the caffeine half-life. That's why there's a lot of individuals out there that recommend having your last cup of coffee 12 hours before you go to bed, so that caffeine isn't in your system. In theory, taking that a step further, since your body is having, and we'll go deeper into this, but adenosine, which caffeine acts on, is a big precursor to sleep. So even having that last cup of coffee 14 hours before sleep might be more beneficial if you're someone that struggles to go to sleep and stay asleep For me, I try to have my last cup before 12. In an ideal world, it's 11 o'clock here. This should be my last cup. I really don't have a problem falling asleep. So I'm going to have another cup after this one. So again, the half-life of caffeine can be changed by many things, alcohol, nicotine, and we'll talk about that. But what we talked about earlier is genetics matter. There's going to be some people that get caffeine headaches when they stop taking caffeine, and there's going to be other individuals that can quit cold turkey and not have any issues. The other thing is dosage matters. Like we talked about in the previous slide, 50 milligrams of caffeine, 1 cup of coffee is going to affect your body a lot different than having an energy drink and having an energy drink with 200 to 300 milligrams caffeine. You're going to feel more alert, but you're also going to get more jittery and more likely to have that caffeine crash. So that dosage matters. As we talked about, the timing matters, especially if you're someone that struggles to fall asleep. You want to, have that last cup of coffee at least 12 hours before you're going to bed. Alcohol is going to change the effect. It increases the half-life, and it decreases the clearance. When I was in college, in undergrad, it was the rise of Four Loko. I don't know if you guys remember that. But Four Loko had very high alcohol content and very high caffeine content. And what that did is the caffeine stayed in the body for a longer period of time, and it left the body less effectively when someone consumes alcohol. So that we're stimulated at a higher level for a longer period of time when we mix alcohol and caffeine. Four Loko, I believe, got sued. They completely had to change the dynamics of what they put in their drinks, and they aren't sold at that 2009, 2011 level of caffeine and alcohol like they used to because there were people that had heart issues, and I believe a couple people even died. But that was a high level of caffeine. I think it was in the 400, 500 milligrams, and then it had a high alcohol level as well. The other thing that is interesting is that cigarettes double the rate of caffeine clearance, and this really stood out to me. I used to work in a kitchen, worked dishwasher, worked cooking, worked on the fryer, and a lot of the individuals that I worked with smoked, and they drank a lot of coffee. I mean, I'm talking 2 to 3 pots. We opened at 4 in the morning, and they drank a lot of coffee. But it makes sense because the caffeine was leaving their body quicker than it was for me or someone that didn't smoke. For instance, their caffeine half-life would have been 3 hours if we said it doubled. So caffeine would have been out of their body in 6 hours. So 12-hour shift, a lot more coffee. So definitely saw that in a real-world environment, but just an interesting aspect if you're someone that smokes and notice that you drink a lot more coffee, or you're someone that mixes alcohol and caffeine and you notice that it really amplifies the stimulatory effect. That's why. And the big thing that we're learning is the caffeine and the effect on the adenosine system, and we're learning more and more about that system, and it's part of the sleep system. We're continuing to learn more about it. One thing that I found when I was researching the half-life and looking into half-life of caffeine is so here you can see the caffeine half-life here and the dose here, caffeine dose, caffeine clearance, and there's other things that are going to affect how caffeine is processed in the body, specifically oral contraceptives, and as we talked about, smoking as well. Okay, so caffeine's impact is complicated. If you're someone that has migraines or been treated for migraines and is working to get their migraines to go away, oftentimes someone will say, oh, caffeine helps, and then other people will say, no, caffeine does not help. That triggers my migraines. I know that if I have caffeine, that it is going to give me a headache. So when it comes to caffeine's impact on the body, there's a lot of stuff going on, and it's going to be dependent on the individual, the effect on the body. because what we're still learning about how the different physiological processes. To me, caffeine, when it comes to saying, oh, caffeine has a positive impact on the body or a negative impact on the body, it's the same thing as we see when we see, it seems like every 2 to 3 years a study comes out on red wine or dark chocolate saying it's good for you or it's bad for you. There's a lot of literature, and you can look at that literature and slice it a different way and make a conclusion. Because there's so much individual variability with things like red wine, dark chocolate, caffeine, these little tiny things that we ingest repeatedly over time, that individual variability, the genetics of the population being studied, all of that changes the impact and the outcome for that group. And so that's why we oftentimes see a study saying this is good for you and this is bad for you, or this is good for you and this is bad for you, or this might not have an effect. And caffeine really is the same way. So, positive effects of caffeine, or more the stimulating effects of caffeine. It's thought to improve short-term memory, decrease fatigue, and enhance mental function. Possibly there's a relationship in reducing cognitive decline, maybe only seen in women. So one of the arguments against the positive effects of caffeine is that a lot of the effects of caffeine are seen when it comes to improving short-term memory or really decreasing fatigue or enhancing mental function. It's seen in individuals that are tired, are depressed, are cognitively fatigued, are overworked. So if you take those aspects out of the equation, then that effect of caffeine isn't going to be as large and possibly not even statistically significant, meaning that for me, a well-rested individual on some days or most days, hopefully, caffeine isn't going to cause these positive effects if you're well-rested. They might cause a stimulation. They might stimulate the nervous system. They will stimulate the nervous system. You might feel jittery, but when it comes to actually improving short-term memory, decreasing fatigue, enhancing mental function, the research really isn't there, in my opinion. When we talk about the possible relationship in reducing cognitive decline, there's been a lot of studies that have been done looking at that, and the studies have really shown that it benefits women the most. Maybe it's only seen in women. There was a study that looked back 30 years over a group of Japanese American men post-World War II. And what it found is that individuals that consumed higher rates of coffee had lower rates of Parkinson's disease. This was a prospective longitudinal Honolulu Heart Program between 1965 and 1968. And it indicated that higher coffee and caffeine intake is associated with a significantly lower incidence of Parkinson's disease. But again, there's going to be a lot of other things that play a role in that, and we don't fully understand why that happens yet. Hopefully we will someday, but we don't yet. So, potential negative side effects of caffeine. We're going to have restlessness. We're going to have shakiness, headaches, which is why you're here to listen about. Insomnia, that's going to really play a role with that half-life that we talked about, that 5 to 6 hours staying in the body, caffeine staying in the body 10 to 12 hours. So if you're someone that has insomnia, again, cutting that caffeine down or having your last cup of coffee earlier in the day can improve that. That dizziness, abnormal heart rhythm, again, high doses of caffeine, higher stimulate is going to negatively affect the nervous system because it's just going to become overstimulated. And that's really what we see over here, that restlessness, shakiness, insomnia, dizziness, abnormal heart rhythm, all of that's going to do with that overstimulus of the central nervous system. And then, again, caffeine has adverse effects with certain medications. So if you're taking a stimulant and you add a stimulant to it, it's going to increase that effect, which for a lot of individuals isn't going to be good. On the opposite side of that, if you're taking a depressant and then you take a stimulant, then that's going to counteract it, and everything's going to have a different dynamic. So when it comes to high levels of caffeine, if you're taking caffeine and you you wonder about how it interacts with your medicine, talk to your primary care physician or the individual that prescribed you that medicine. We're going to talk more about headaches. So with everything, there's nuance, and caffeine is another one of those nuances. It has cognitive effects, but it's more effective in withdrawn and fatigued individuals. It has positive effects maybe when it comes to neurological disorders like Parkinson's disease and Alzheimer's, but it's more pronounced in women. Pain relief, again, thinking back to migraine, there's some people that respond well to caffeine, and then other people that where it's a trigger and it's going to cause migraine or trigger a migraine, the sequela of the start of a migraine. There's, look at it, reproductive effects. There's a reason that the doctors say don't consume high levels or even low levels of caffeine when you're pregnant. Talk to your OBGYN about that. I'm not going to dive into that today. And then we can just go ahead and, look at all of these. Rarely is science conclusive with all of these, but there are some that it is conclusive, specifically the birth weight, the cardiovascular function, the reproductive effects. All of those are pretty cut and dry. We talked about the other factors that play a role when it comes to the cigarette smoking doubling the rate of caffeine clearance. We talked about substantial alcohol intake will increase the half-life of caffeine and decrease its clearance, and how that will stay in the body and cause us to be jittery or have the effect for a longer period of time. So let's talk about caffeine withdrawal headaches. Caffeine withdrawal headaches, there is that genetic factor that we talked about. What happens is you have receptors, okay? And these adenosine receptors have adenosine, and adenosine binds to the receptor. And what that does is it increases blood flow, oxygen to the brain, and prepares us for sleep. Throughout the day, that adenosine level starts lower in the morning. Obviously, we don't want to be tired and preparing for sleep. And then it increases throughout the day before we go into sleep. What happens with caffeine is it is similar to adenosine. So you have this receptor that causes an effect when adenosine binds to it. But when we drink caffeine, what happens is caffeine binds to this receptor, and it doesn't cause the effect. So then what the body does is it says, hey, our receptors aren't working. We're going to create more receptors. So now you have all these other receptors for all these adenosines to bind to. But with us drinking caffeine, we keep filling these receptors with the caffeine. And so the body isn't able to produce the proper physiological response due to caffeine. So what happens is you get this buildup of adenosine receptors, and then since all of these receptors are blocked by caffeine, the adenosine builds up as well. So you have a lot of adenosine and you have a lot of receptors and nothing happening from a physiology standpoint because the caffeine is blocking the adenosine from performing that goal. So you have the buildup, more receptors, and then all of a sudden you don't have caffeine. There's no caffeine, and you have all this adenosine built up. You have all these receptors, and all of a sudden adenosine rushes to those receptors. It causes vasodilation, so it causes those blood vessels to open up like they should, but they haven't been able to open up as much as normal. And because those blood vessels are pain sensitive, that rapid vasodilation causes it's thought to cause the withdrawal headaches because of the painful aspect on the vascularity that's affected. So no caffeine, open sites for adenosine. You have a large increase in adenosine, leads to an increased vasodilation of pain-sensitive cerebral blood vessels. So that's why we get caffeine withdrawal headaches. That's thought to be the reason why we get caffeine withdrawal headaches, is because caffeine mimics adenosine and doesn't allow the receptor, the adenosine, to bind to the receptor and that physiological process to occur. So if you don't want caffeine withdrawal headaches, what can you do? Well, obviously you can continue to drink caffeine, but if you're someone that wants to reduce their caffeine consumption, you want to taper down. So say I have 3 cups of coffee for, that's typically what I drink. Well, the next week, let's drop it down to 2 cups of coffee. Okay, do 2 cups of coffee that next week, and then maybe 1.5 cups the next after that. And it's just going to be a slow, stepwise decrease in coffee consumption over time. And that taper should allow the body to start to respond properly, those receptors to reset, and the adenosine not to build up. There has been some studies on supplementation and how it might help with caffeine withdrawal headaches, specifically looking at magnesium. But this was also looking at individuals that got menstrual-related migraines as well. So again, that's why that asterisk is there. Supplementation may help. There's our references that we looked at. Thank you all for watching this video. I hope you got some information from it that you can take home as helpful. Again, my name is Dr. Jake Kaufman. I'm a chiropractor at Optimize Chiropractic, located here in Upper Arlington, Ohio. I run a data-driven chiropractic office. We practice QSM3 chiropractic, which is an upper cervical chiropractic technique. We do proprioceptive rehabilitation and cervical ocular rehabilitation. Work with a lot of individuals with headaches, migraine, dizziness, whiplash, neck pain. If you have any questions about what we do or about this presentation, feel free to contact me at drkaufman@optimizecolumbus.com or give me a call at 614-769-7831. Thank you all, and hope you have an absolutely great day.